Joining us now is a consultant interventional cardiologist, Dr. Tosin Majekodunmi. Hello, Dr. Majekodunmi. It's always a pleasure to have you on the show.
Hi, good morning. Pleasure to be here.
Yes. So tell us, what is this aortic aneurysm? What exactly is it? Where is it in the body?
Aortic aneurysms are one of those conditions that is associated with one of the things I'm sure you've talked about on your show on many occasions, which is hypertension. And it's not one of the ones we talk about because it's less common a complication than some of the other common complications like heart attacks, renal failure, heart failure, and things like that. An aneurysm, to answer your question directly, is an abnormal swelling in the major blood vessel that supplies the organs of the body. The two commonest sites to get them are in the abdomen and also in the chest, just where the blood vessel comes out of the heart. Those are the two areas you can get aneurysms. And the reason why this happens is because when the wall of that blood vessel is exposed to a higher than normal pressure for a long period of time, in some people, for reasons that we are not clear about, the walls become very weak and then they swell, almost like you are blowing up a balloon, and it becomes more swollen. And eventually, one of two things can happen, both of which are dangerous. One is that the balloon can burst or rupture, which obviously can be catastrophic. And the other is that the lining of the blood vessel can develop a tear in it, which can also cause complications. So just like hypertension, the best way to prevent it is, in the first place, to make sure if you have high blood pressure, you treat your high blood pressure meticulously. And so, as I always try and take the opportunity to say on these occasions, you want your blood pressure to be less than 130/80 consistently. If you are taking your medication, if you have high blood pressure and you are taking medication every day very diligently, and your blood pressure is 150, you are nowhere. Your blood pressure needs to be consistently less than 130/80. In that way, you reduce your risk of having the aneurysm in the first place. So if it is a major rupture and the whole vessel basically bursts, it is very unlikely anywhere in the world that that patient is going to survive. That's the first thing. If you get a smaller rupture that is contained, then you have an opportunity to do something. And the something is either to operate emergently, or sometimes you can deal with these things without operating by putting a stent across the aneurysm to close off the aneurysm and restore the integrity of the vessel walls. The way that people can know that they may be having something that causes an aneurysm is typically abdominal pain. If it's an abdominal aortic aneurysm, people get pain in their abdomen. They will usually say it's radiating to the back. So whenever people have these kinds of symptoms and they're hypertensive and maybe a little bit elderly, it's very important that when they go to hospital, the doctors who are looking after them bear in mind the fact that this patient may be having a ruptured aneurysm.
You said that when you have that full ruptured aneurysm, it can be quite fatal.
Yes.
Could you give us an idea
Yes.
from the moment, when you have that partly ruptured one, the time you have, how long does somebody have to get to be revived in the hospital? Because sometimes you get to the hospital, this is a Nigerian factor. They tell you want to do CT scan, want to do this, want to do that, and families are still running health care, they're looking for money. All that time is being lost and the patient dies. So could you give us the time frame you have when that happens? How long does the patient have to survive?
So it's very difficult to give an exact time, because whenever you have these things, until you visualize it, you don't know. But for us, a possible ruptured abdominal aortic aneurysm is a medical emergency, and that means it needs to be dealt with immediately. There is no delay that's acceptable. Now, getting a CT scan should be immediate. So once the patient hits the hospital, once it passes the doctor's mind that this patient may have a ruptured aortic aneurysm, you need to get a CT scan literally within 15 minutes. Like it's that, I'm talking about that quick. And once you've done the CT scan, you need a vascular surgeon or an interventional radiologist to get in there and operate, either do an open operation to deal with the problem or to take the patient to a cath lab and put in a stent graft to manage the situation. And there are only about 2 or 3 hospitals, certainly in Lagos, that can do that immediately.
Okay, obviously,
So
what you just
availability
described,
is
Dr.
certainly a problem.
Majekodunmi, I'm sorry to cut you. What you just described obviously sounds very, very far-fetched. So I think we would like to maybe spend more time on prevention.
At a point, when you were talking, I tuned off. You know why? Because I just thought about all the clinics I see on the road, where I take any ruptured aneurysm person there, it's goodbye.
Dead.
Yeah, so
It's goodbye. Let us be, even if I take them to maybe General Hospital, go safe. It's goodbye.
because
I think you make some very good points, but I think there are still, even within our environment, there are reasons for optimism. There are some hospitals, and I'll certainly include mine in that group, where if you present in a timely fashion, we can get a CT scan done within 10 minutes of you walking through the door. We can get you to the cath lab within 30 minutes and do whatever we need to do to sort out the problem. Now, I do agree that, of course, our hospital is exceptional. It is not the norm. And the vast majority of hospitals that are out there are not in the fortunate position to being able to provide these facilities.
But Dr. Majekodunmi, you said something very vital. You said if it crosses the mind of the doctor, this is Nigeria. Outside malaria and typhoid, what else are we thinking about?
It doesn't cross the mind.
It doesn't cross the mind of our doctors.
There is one more.
So I think that is the reason why this television show that you are doing is very important, because what we need to do is to continually raise awareness, or both on the side of the doctors and also on the side of the patient, so that it starts to cross people's minds more and more.
I just want to give kudos to you and thank you and the management of TFC, because this program is now come to international, because look at the people that you always brought on to tell us some certain things. This morning, I was just listening to the doctor. In fact, God will bless you, doctor, because there's a lot of things that we don't even know that is happening to us. Look at the hypertension that everybody will just think is just hypertension, and then we take 1 or 2 drugs. And then this morning, doctor made us to know that you can even take almost 1, 2, 3, 4, 5 drugs. To bring this thing down to normal. I've never had that in my life. Thank you. God bless you once again.
Thank you. Thank you. We have to let you go, Dr. Majekodunmi. I think you've given us enough bad news this morning.
I hope the good news is that if you treat your blood pressure to less than 130/80, the risk of any of these bad things happening is very, very low. And that, I think, is the good news. And it is very achievable. Fantastic. The drugs are out there. It can be done.